Well, good morning. Thank you everyone for spending time to join us today. I am Washington State Representative My-Linh and co-chair of the CSG West Committee on Health and Human Services. Today, I am excited to welcome the Casey family programs to discuss improving child welfare and the outcome for children and families. I am very pleased to introduce the former Washington State Representative Eric Pettigrew, trustee for the Casey Family Program, and David Sanders, the executive president of System Improvement. Please join me in welcoming both of them. Eric, good morning. I'm gonna pass the microphone to you, the virtual microphone to you.
Thank you, Representative Tai. It's so good to see you as always. I did see you walking through the halls there. I know you're really working hard, helping us figure out this budget challenge that we have. But I just wanted to say thank you to CSG West for the opportunity to partner on this legislative exchange and your commitment to your members to provide nonpartisan professional growth, opportunities in pursuit of excellence in state government. You know, I had the honor of serving in the Washington State Legislature along with Representative Tai for 9 two-year terms, and 10 of those years were as the caucus chair. I represented a district that is very diverse economically and ethnically, and my constituents were some of the richest and the poorest residents in the state. So working within that district taught me the art of balance and learning to work across aisle. And I was very proud of my work working within the tent. You know, every party has a tent, and there's room for everyone in that tent, depending on just not depending on just their opinions. And working within the Democratic tent as well as in the Republican tent, where I found the most common ground in working that tent was working for children and advocating for children and their families, despite or whatever the parties were. I've been once again fortunate to continue that work by being a board member on the Casey Family Programs. And just to give you some background, if you are familiar with Casey Family, it was founded in 1966. It works in all 50 states, and in addition to Washington, D.C., Puerto Rico, the U.S. Virgin Islands, and with tribal nations across North America to influence long-lasting improvements to the well-being of children, families, and communities where they live. Casey Family Programs is the nation's largest operating foundation focused on safely reducing the need for foster care in the United States. Our mission is to provide and improve, ultimately prevent the need for foster care. We currently have an active engagement with all the jurisdictions in CSG West, as well as many tribal nations throughout the region. We are committed to partnering with you and being a resource to you and your communities in the critical work. You know, we work with a wide range of partners like the Council of State Governments West, including the children and families we serve each day, to safely reduce the need for foster care in the United States by 50%. Casey works in support of our partners at the federal, tribal, state, and local levels to develop policies and practices that best meet the needs of families and their children. We demonstrate how children every child can have a safe, supportive, and permanent family. Casey works with children and families to provide and improve foster care and prevention services that promote their safety and well-being. We support more effective public investments in strengthening families to keep children safely in their own homes and communities. Casey contributes nonpartisan information data and resources to policymakers at all levels of government to improve the impact of our nation's investment in communities for supporting child and family safety and well-being. Looking at what's the movement that's happening in politics nationwide, I'd be curious to hear some of your opinions, but I think that a lot of the definitely from Dr. Sanders, a lot of some of the new work is going to happen even more so at the state levels and the relationships that we have not only with the federal government but amongst ourselves within states, and the lessons that we learn across states will be extremely important. So organizations like CSG West, it will be even more critical than they've been up to this point as it relates to the issues that Casey family faces working with child welfare. With that, it's now my pleasure to introduce you to a man I consider to be incredibly brilliant, David Sanders. He's the Executive Vice President of Systems Improvement and Casey Family Programs. Dr. Sanders.
Thank you very much, Eric. That's very generous of you, and we are really excited to have your expertise on the board. So I'm David Sanders, and I was asked to give somewhat of an introduction to child protection, but really with the focus of what you could expect in the legislative branch of the agency that is responsible for providing child protection services, whether it's a state agency or county-run agency. Now, that concept in many cases seems very complex because there are a lot of issues that, like the lack of sharing of information or the struggle with finding resources, turnover of staff, all sorts of issues that seem to impede what can be expected of the Child Protection Agency. And what I hope to do is to make it as simple as possible. And one of the key questions is going to be, can you measure success? And can you have expectations about the performance of the agency that are understandable and that can be applied over a period of time? It appears, at least on the surface, that many child protection agencies lurch from crisis to crisis. And whether that is a crisis of children sleeping in offices, of children being sent out of state and unable to find placements in the state, of children languishing in foster care, or of children being hurt or killed by their families. What I'll be doing today primarily is using data to help to define what the system looks like and what you can expect. And the stories that all of you are familiar with are really critical and really important, but being able to plan, to measure, and to interpret data is, in my view, critical to actually managing how child protection works. I'm going to start with just an overview of the Child Protection Agency and some questions that I think you can be asking, and also will provide some context using data. And then I'll talk a little about the data for each of your systems, as well as some of the work that we've done in trying to evaluate the performance of agencies, and then close with some questions and some ideas. And before jumping into the presentation, just a bit on my background. As Eric mentioned, I am a vice president at Casey Family Programs, responsible for our work with states, for our public policy work, including our federal policy work, as well as our state policy work, our research, and our work with a variety of partners in the field. Prior to coming to Casey, I directed services in 2 large urban jurisdictions, was responsible for child protection services, well, for children's services in Hennepin County in Minnesota and in Minneapolis, and then following that in Los Angeles County. And so have almost 14 years of experience of actually directing agencies, in addition to a number of years now, being able to interact with and observe the performance of agencies across the country. As Eric said, we have agreements with all 50 states, with a number of tribes, and we are able to see the work really firsthand. The other thing that I've had an incredible opportunity to do is to serve on a variety of commissions and committees, both at a state and county level, as well as at a federal level, and was fortunate to chair the Federal Commission to Eliminate Child Abuse and Neglect Fatalities, which was congressionally created and had members appointed by the president as well as members of Congress. So that's the perspective that you'll be hearing, which is primarily around the work in child protection. So next slide. In my view, the question of how you know whether you have a successful child protection system is absolutely critical. That is the single most important measure of whether the system is meeting public expectations. And I mentioned my background in part because I've had considerable firsthand experience in hearing what the public expects about child protection agencies. Sometimes very welcome, sometimes through headlines in the newspaper or through community meetings. But in the years that I've been doing this, what I've heard consistently is the public is concerned about, first, if children are brought to the attention of child protection, they expect those children to be safe. That the idea of a child being hurt after the child protection agency has been called is unacceptable, and that the public is quick to hear. The agency is quick to hear the public's wrath when that happens. And second, children shouldn't languish in foster care. That if an agency head says to a community or says to a family, it's going to take us, it on the average takes us 3 years from the time a child comes into our system for us to adopt them. The question is why? Why does it take so long? If you know that the child's in harm's way and can't be returned to their family, then why does it take 3 years for them to be adopted or longer? And those two expectations to me are really what the most important factors in determining an agency's success. Next slide. So the question of how to keep children safe, and I put this up as something that is an important learning that I've had over the years. There is a child well-being or child welfare system, and that system includes multiple agencies, includes families, includes parks, includes schools, includes health, education, playgrounds, after-school activities, family resource centers, all of the things that we would hope to have in a community to make sure that children are growing up healthy, cared for, safe, and thriving. And that takes much more than a child protection agency. The Child Protection Agency is that mandated entity that takes reports of child abuse and neglect and disposes of those reports. And it plays a critical but very narrow role in child well-being in a community. And so why do I put this under how do we keep children safe? Well, a large part of the reason is that, first of all, the Child Protection Agency cannot keep children safe by itself. What the Child Protection Agency offers is an ability to assess. There are resources for families who may be unable to care for their children, but the Child Protection Agency does not provide the kind of community support that needs to surround families to assure that children are safe. Unfortunately, in many cases, the Child Protection Agency is the place that people go to for help. Child Protection Agency is not a helping agency as much as it is an enforcement agency. And so what happens is that the Child Protection Agency in an attempt to help a lot of families who really do need the help, are not providing the necessary supports to children who are actually in harm's way and who are at risk of being abused or neglected immediately. And so the agency ends up providing services that it really doesn't have the resources to do, and not providing the services to those families who really need support. And I'm going to come back to this theme several times as I go through the rest of this presentation. Next one. Next slide. So these are just some things that I think you can consider today as we're going through this conversation. How can you keep children safe? What's happening across the country? What are some of the best practices, and what kinds of things can you do? What are the elements of a well-functioning child protection agency, and how can you use data to evaluate your system? And that's really where I'm going to spend most of the time in the next few slides, is this use of data to evaluate your system. Next slide. So one of the things that I often hear is just, how complex the child protection agency seems. And what I hope to do with this slide is both point to the commonalities across states, certainly across the 13 states that are part of CSG, the West region, but really across all 50 states and territories. So there are really common elements that every state and county that provides child protection shares. One is that there is some way to take reports of abuse or neglect from the community. And that's through all states and counties have some kind of hotline that people in the community can call to report suspected abuse or neglect. All states mandate certain people to make a call when they suspect abuse or neglect. So for some states, it's helping professionals. Some states would include law enforcement, education. Some states include essentially everybody who comes into contact with the child. But every state defines a set of mandated reporters that must report when a child is suspected to have been abused or neglected. Those mandated reports go to hotlines, and then after it goes to a hotline, a determination is made by the state or county agency. Does this meet the legal requirements for an investigation? If it does, then the family will be investigated by the Child Protection Agency. If it does not, then the family is maybe offered services in some cases, but there's not a consistent response across the country or across states. And so those calls may be lost, they may be recorded, but those families don't receive any further services from the Child Protection Agency. Of those then that are investigated, there will be a finding that abuse or neglect occurred or did not occur, and there will be some disposition, and some children will receive services. So what this inverted triangle represents is the funnel from calls to child protection hotlines across the country, all the way to those who end up in out-of-home placement, to really give a perspective of what that looks like. So there are 7 million children who are reported on during a calendar year across the country. Of those, 3.1 million are actually investigated. So 4.7 million don't receive anything further from the Child Protection Agency. Of that group, of the 3.1 million, about less than 1 million actually receive some kind of services. And of that, 145,000 receive placement. So you can see that the resources going into taking calls and to investigating children and families is considerable. Those who actually receive supports from the Child Protection Agency is fewer than 12%. Next slide. Now, going just numerically, on the last slide, 3.1 million were investigated. This is how many of that percentage were reported for neglect as a maltreatment allegation. Generally, when the public thinks of calls to the Child Protection Hotline, they're thinking of the most heinous situations. A child has been physically abused or terribly tortured. Something terrible has happened to a child. And while neglect is certainly not an acceptable parental behavior, nor are they necessarily mild situations, most people don't think of neglect as the driver of calls to child protection agencies. But as you can see from this slide, over 60% of children are reported screened in for neglect as a maltreatment allegation of those that are coming into the Child Protection Agency. And I'm going to come back to this in a little while. Next slide. What is, I mentioned, wanted to leave you with some information that could help you to assess where your system is. And this is one of the first slides that'll do that. So this is taking the percentage of calls that come in that are identified as requiring an investigation and what percentage of those state by state are calls for neglect. And you can see the range of the states in the West region from 22% in Hawaii to 96% in Montana of calls that include neglect. Now, it's really difficult to compare, and I'll mention this several times because the definitions of neglect are so different across states. So this doesn't necessarily reflect these numbers don't mean the same from state to state. Some states encourage calls with neglect by having a very broad definition, others with a much narrower definition. But this really does begin to show the importance of policy in determining what the Child Protection Agency does and what your child protection system looks like. Next slide. So this goes to the bottom of the inverted pyramid where 145,000 children were entered foster care. Now, those with a sharp eye will see that this page shows 184,000, and that's because they're actually different data sources and slightly different counts. This would include children that are not included in the previous slide, but the trend line is what's most critical. And that is over the last 20 years, there has been about a 40% decrease in the number of children entering foster care. And that's a trend that has been consistent for almost the last 8 or 9 years. And this really does suggest that the Child Protection Agency today has different needs and is functioning different than it did 10 to 15 years ago. Next slide. And what this again reflects is each of the states in the West region and the number of the rate of children in out-of-home care. And again, this does reflect differences in state policy and the desire to provide out-of-home care for more or fewer children. So in Utah, the percentage is only 1.5% out of 1,000, 1.5 out of every 1,000 children enters out-of-home care, whereas in Montana, that number is 6. And so you can see the variation. And again, I'll come back to this issue as we have more discussion, but really want to highlight the differences here. Next slide. So this next slide is the children in out-of-home care. The previous was children entering out-of-home care. This is children in out-of-home care on the last day of the fiscal year, federal fiscal year. And it is, again, reflects the reduction of the total number of children in care. And you can see what the trend line has been. It certainly is close to the children who are entering care, similar trend line. Next slide. But this again is where the differences among states are highlighted. And one of the key questions that we'll talk about a little later is, what do you want your child protection agency to look like? Because this really does speak to the values, how you see children and families being treated, and how, again, policy can really drive the performance and outcomes of states. So let's go to the next slide. Now, what we're going to begin to get into, so the previous ones were really to provide some context about what the systems look like, because they are different from state to state, and it's important to have that context. What I'm going to get into now are really 5 measures that we believe are most critical in assessing the performance of a child protection agency, and that if there's anything that you leave this conversation with, it is that you can assess your agency's performance, and you need to have actual metrics to do that. And part of that is really looking at how to make sure that policy, practice, and judicial oversight are all aligned in the same way to achieve the same kind of outcomes. I mentioned earlier that safety and children not languishing in care are the 2 public expectations for the Child Protection Agency from my perspective. And these first 3 slides, or first 3 measures, will all be reflective of safety and giving a sense of how well your Child Protection Agency is doing to keep children safe. So the first is maltreatment recurrence. And what this measures is if a child experiences maltreatment, if they've been abused or neglected, and then within 1 year, is there a second report, substantiated report, that they have been abused or neglected? So if they've been abused or neglected in October of 25, and they are abused or neglected again in January of 26, they would fall into here. And that's essentially saying that after the intervention, that the child should not be abused or neglected again. And you can see that with these are the national numbers, and there has been a slight decrease during that time of maltreatment recurrence, the measure of maltreatment recurrence. What's important, though, is that this occurred through a time of a significant drop in the use of out-of-home placement. There have always been concerns that if children are not placed in foster care, that their risk of being harmed or abused is much higher. And what this seems to show is that in spite of a lot fewer children going into care, that the risk of being re-abused has not gone up. And they're concerned that it is not sufficient to say that this is definitive to suggest that there are other interventions that can be just as effective, but it does at least point to, for the last 15 to 20 years, it doesn't appear that children are less safe, even though fewer children are in out-of-home care. And I'm going to come back to that in just a little while. The second part of this is, again, looking from state to state. And I would just reiterate once again, it's very difficult to compare state to state because each state has a different definition of neglect. And so some states have a much broader definition, and therefore the likelihood of a maltreatment recurrence is going to be higher because circumstances in some states would be called maltreatment that in other states would not be. What the value of this is to be able to measure from year to year within a state. And so being able to look at New Mexico and see whether there has been an increase or decrease in recurrence of maltreatment. And you can see most states have stayed essentially within the same range. A couple have had some increases, a couple have had some decreases, but this is a critical measure to be able to speak to the question of are children safe. And one of the really important pieces of this is that it also captures, you're also potentially able to capture the severity of the maltreatment recurrence. And so are children in care having less serious re-abuse, or is it getting worse? And you can then begin to look at interventions that might have an impact. So this is, in my view, one of the most critical measures that you can use to really determine the effectiveness of your intervention. Next slide. The next slide, again, is a measure of safety. And this is reentry into care. So of the children who are returned, who exit foster care to permanency of some sort, generally reunification, occasionally kinship care, and occasionally adoption, although the adoptions are probably not captured here. Within 12 months, do they enter care again? So they've gone home after being in foster care, but within 12 months, they re-enter again. And usually that re-entry is going to be because they've been re-abused. This number should be going down, and as you can see, the number has been going down, that the re-entry into care is considerably less today than it was 12 years ago. And that's an important factor to consider in assessing your agency, because this means that children are hopefully staying where they have gone after being served, rather than being re-abused and brought back into the system. Next slide. And similarly, this is a state comparison. And the value, again, looking from year to year. So looking at a state like Wyoming, it looks like there has been consistent improvement in this over the last 10 to 12 years. And similarly, Arizona, though that would be important for the legislature in really determining, so how are we doing in assuring that children are safe and that they aren't coming back and in and out of care because they've been reunified prematurely or without services or success. Next slide. Well, this one is a bit more controversial in many ways, because this is child maltreatment fatalities. And this is often what triggers policy change in a jurisdiction, is a heinous child maltreatment fatality. What you can see from this slide is that the number is very small. This is 2.7 out of 100,000 children. So the number of children who are injured, severely injured, or who die as a result of child maltreatment is very small. But it's important because of the expectations that the public has, and I'm sure that all of you have, that any child who is taken into the care of an agency should not face harm, should not face such serious harm that their life is threatened. And so it's important to keep an eye on this, although I would emphasize this is not solely a child protection agency responsibility. As I mentioned, I was fortunate to serve on the Commission to Eliminate Child Abuse and Neglect Fatalities, and one of the learnings for us was that this number of child maltreatment fatalities, approximately half of these children are known to the child protection agencies across the country. So it's approximately 1,800 children, 1,900 children, 1,900 fatalities. About half of them were known to the child protection agency before the fatality, but over 90% were known to a primary care physician. And so it speaks to the importance of the engagement of those outside of child protection in keeping children safe. Next slide. And this is a state measure. Again, the numbers are so low that it's really hard to determine from year to year how significant an increase or decrease is. But it's important because of the victims and keeping what our learnings are about how to prevent this in front of everybody, and making sure that this number begins to go down. As you could see from the last slide, the number of child maltreatment fatalities has consistently increased for the last 20 years or so. Next slide. So those three are, in my view, the most important of the safety measures that we could have. Now I'm going to move into children languishing in care. And I'll talk a little more about this because of the importance of this. While it may not be as visible as safety measures, to me, this is just as critical because length of time in care correlates with so many poor outcomes for children. And I'll talk a little about that. So this first slide is of all children entering care, what percentage exit care to permanency within 2 years? So if a child has been placed in 2023, and what percentage will have exited care to permanency by 2005? Now, the first thing I would say is that I don't have any reason, and I imagine probably very few of you do, that a child is in limbo for 2 years without knowing what family they're going to return to. That 2 years, while is the national standard, there's not a particularly good policy, practice, or research reason for children to be in care for that long. Children need stability. We know the importance of relationship with a caring adult, and to the extent that that relationship is threatened, the ability for children to function long-term is compromised. So I say that as a just recognizing that this is not a particularly ambitious goal, and yet 46% of children are receiving permanency within 2 years. That means 54% of all children who enter care are there for longer than 2 years. And I think that this is an area that, as you can see, has remained fairly stable over the last 20 years. And I would suggest that this is an area that needs considerable attention, that foster care is designed as a short-term temporary respite, and right now it's being used as a long-term intervention for a large number of children. Next slide. And this goes directly at the question of are children languishing in care? These are the percentages from state to state. They vary again considerably. In Alaska, 30% of children are in care, are finding permanency within 2 years, meaning 70% of children are in care for longer than 2 years. And that goes up to in the 60s for a handful of states. But again, with those states, almost 40% of children are in care for longer than 2 years. So this is an area that I think requires considerable attention. The next slide is the last of the 5 measures that I think are critical for assessing the performance of any agency, and that's children in care for 2 or more years. So taking that group that we were talking about earlier that are still in care after 2 years, what percentage of those children achieve permanency within a year after that? So after 3 years, essentially, how many children have gone into permanency versus how many are still in temporary care? And that number has been going up, which is great. A lot of attention has been paid for children who've been in care for a number of years, and this is reflective of that. However, so for a state that has 54% still in care after 2 years, this is still only about 1/3 of those children achieve permanency, which means 2/3 of those who are in care after 2 years are still not achieving permanency. So while this is a promising movement, it still means that far too many children are in care for 2, 3, 4, 5, or 6 years without having permanency. And we know that the children who are being sent out of state, children who are in residential treatment for extended periods of time, children who are sleeping in offices, generally fall into this category. And so addressing this, making sure that the agency and the system are moving children into permanent caring homes is going to address many issues that many of you are faced with. And then I'll close this off with the state comparison, again, looking at the variety of results per state. And there has been some improvement, but there's, again, room to grow in this area. So I'm going to stop for a second and just present some ideas of just examples of ways of structures that can be put in place that can help with legislative oversight, but really want to see if there are any questions. So the oversight committees is certainly something that can be done. Those committees can include, go back to the last slide. Those committees can be used, can be used to really help with help in keeping the legislature informed about what's happening, can work across the 3 branches in ways that I know some states have done, and can really implement changes in ways that are difficult to do without that kind of structure in place. There can be hearings where questions along the lines of how is the agency performing, what information is it reporting to you, how is that information shared with the legislature, how the judiciary sees this, are all key questions that could be part of informal hearings. Certainly a legislative caucus that is dedicated to improving outcomes and also being engaged in together in trying to address the issue. And similarly, the convening of a variety of partners, particularly across those agencies that have direct responsibility for child protection, can be led by the legislature. So those are just some ideas of structure. I'm going to stop and see if there are any questions before moving on, or any comments. And I don't know if there's been anything in the chat.
Thanks, Dr. Sanders. If folks have questions, please feel free to add them to the chat or raise your hand. You're welcome to join us off mute. If you have any questions about the data that Dr. Sanders has presented today. Not seeing any at this time.
Thanks. Next slide.
Vanessa, I have some from registration that I'm happy to throw out there if this is a good time.
Sure.
Great. So this is from Representative Cavero from Arizona. And her question is, where can the average person locate truthful or factual information and statistics regarding child welfare?
Oh, great question. So the Children's Bureau at the Administration for Children and Families at the federal level presents several reports that are available online around child welfare outcomes and outcomes related to out-of-home placement. And I think they're pretty accessible. Vanessa, you may be able to provide a link to that, but those sources are available to the public, if I'm not mistaken, and available online. Those are ones that I might use. There are a number of states, and this is often done through legislative initiative, that are required to report, to do report cards, report information to the public about the performance of their agency. And some do them at one time. I know California had public information available through Berkeley, and that looked at counties and how counties performed. And certainly there are ways that states have looked at providers and provider performance and made that accessible to the public. And that's something that legislators have been pretty active in some other states.
Thank you, Dr. Sanders. We did receive a question in the chat from Representative Ottman from Wyoming. They ask, how do I obtain information to understand what is truly being done or happening? What questions should I ask? How do I do research without appearing threatening? How about with tribes? We have two that have different cultures and thoughts.
So, it is very difficult. I will just say, when I was a child protection director, that it's seen as where you need to protect the agency, and that there is not a necessarily positive relationship with many that are seeking information, whether it's in the community, whether it's other branches of government, and so forth. And so it can be very difficult to get information without seeming threatening. It seems that ways that has happened include some of the things that I mentioned, really requiring a regular report that just asks for the kind of information to be shared with the public. It was interesting, and this is very controversial and not necessarily a position that a number of people have taken. But when I was in Minnesota, there was a decision essentially by the Supreme Court to open up hearings to the public. And what that meant is that the media or members of the public could sit in on court hearings to really see personally and directly what was happening in the Child Protection Agency. There are the oversight and kind of committee discussions can certainly be structured in a way that requires that information be shared, so it's not coming from one member, but really coming from the process. The structure that includes multiple branches of government working together in some kind of committee is also a means of doing that. So I think there are ways of doing it, but it is very difficult because child protection agencies in so many states feel that they are under attack and are reluctant to share information. I would just say that the sharing of information is probably the most important way for things to change, but it can be difficult for people to see.
Okay, I have another one. This is from, let's see, Marta Castaneda. She's with us, CSG West, and her question is, how will anticipated decreased federal funding impact state services?
Well, that's certainly a key question. So as it relates specifically to child welfare, the primary funding source is Title 4E of the Social Security Act. And to this point, there have not been any public conversations about reducing that funding. It's an entitlement, and there haven't been those conversations. However, the conversations about Medicaid are such that if there is a decrease in federal contribution to Medicaid, and it is determined by a change in the match that the federal government provides to states for Medicaid, that would impact child protection, because the foster care rate that's used in 4E uses the same formula. And so if there's a decrease in the federal match for Medicaid, that may also extend into child protection. The other area is in some of the basic needs and supports. There has been considerable research recently that appears to suggest that concrete supports, including financial support, assist in reducing the incidence of abuse or neglect. So to the extent that concrete supports are not available to families, the research would suggest that there could be an increase potentially in abuse or neglect. So those are the areas that would seem to have the biggest impact. Medicaid, as it relates particularly to services available for families, and the issue of what kind of concrete supports families have available to them.
Thank you. Let's see, we have one more here. Is there data to reflect the importance of investing in social determinants of health?
The last piece that I mentioned, the research more recently that seems to suggest that concrete supports are not just correlated with abuse or neglect, but actually are able to reduce abuse or neglect, is covers some of that. So, for example, childcare is one of those concrete supports that seem to have an impact on incidents of abuse or neglect. Beyond that, there is not a lot of research. One of the things that we found in the commission that I mentioned earlier, the Commission to Eliminate Child Abuse and Neglect Fatalities, was at that time there was only one program that had been evaluated to actually impact child abuse and neglect fatalities. Now that's a much different level than what you're asking, but there just is such a dearth of research on the kinds of interventions and activities that are effective as prevention efforts for child abuse and neglect. And that's one area that I think, to the extent that state legislators can encourage more research and more data gathering, I think systems would do better. Having said all of that, it does appear that that additional supports, whether they're community supports, whether they are through healthcare, do at least correlate with lower impact, lower incidence of abuse or neglect. Whether they're causing it is a little harder to say, but there has been enough to say that there's a correlate. And finally, the Family First Prevention and Treatment Act, which was passed in 2018, and essentially almost all states have opted in, has an array of prevention services that are evidence-based, that are eligible for federal funding. And though there's a federal clearinghouse that identifies those services, and we can provide a link to that too, because there are a number of services that have been identified as eligible for funding because they have sufficient research to say that they do assist in preventing abuse or neglect.
Thank you, Dr. Sanders. And I think that's a great segue to the last handful of slides that are focused on neglect.
Yep.
I'll go ahead and click to it now.
Great. And I will close with this. So this is also an area, and I think the last question really is a great segue into this, that essentially all states would define sexual abuse and physical abuse in the same way. And I think most people in the public would say they know when there's sexual abuse, they know when there's physical abuse. Neglect, as I mentioned, is the primary allegation that ends up moving people into the child protection system. And what we have found is that while there is a federal definition of child neglect, essentially every state has modified that definition, or almost every state has modified that definition. And what has resulted is huge variation from state to state in identifying what neglect is. And that has significant implications for the Child Protection Agency as well as for members of the community. And the parallel that I often use is that if I have diabetes in Virginia and I move to West Virginia, I probably still have diabetes. But if I'm considered as somebody who has abused or neglected my children and I move from one state to the other, the likelihood, and you could see it in some of the examples, the likelihood that it will be called the same thing in another state is quite low. And the incidence of placements may be 4 times higher if I go from one state to the other. That has huge implications for the Child Protection Agency. And as I mentioned earlier, to the extent that the agency is not devoted to children who are at highest risk for serious abuse, those children are placed at risk for later injury. And those children who are served are placed at later risk for injury. And I'll give an example and then close because I see we're near the ending hour. The commission found that 80% of children who die due to abuse or neglect or who experience serious injury are under age 5 years and under. And the vast majority or the majority of children who experience serious injury or fatality are under age 2 years and under. But if you ask a worker in your state or in the county that is providing services in your state, who do they spend time with? They will invariably say 17-year-olds who are running away from home or who are running away from facilities or who they're trying to find a place to live or who are in residential care. And the result is that the infants who are at much higher risk for injury, serious injury or fatality, are getting less time than a 17-year-old. And one would have to question, well, why are so many 16 and 17-year-olds being served by the Child Protection Agency when they really aren't at risk of being harmed? And I think that's one of the key issues that states can look at in their definition of abuse or neglect and really identify those children who are at greatest risk as needing the most attention. So I'm going to stop there. This is a huge issue. Many states are taking a look at their definition of abuse, of neglect, and making changes in that definition. And in some cases, it appears that by making those changes, that the agency is much better able to focus on children who really are at risk of injury or harm. So I think I'll stop there, Vanessa, and see if there's any other questions.
Great. Thank you, Dr. Sanders. We referenced a handful of resources, so I do want to share that we will send the PowerPoint in addition to some of the research and data that Dr. Sanders mentioned. I'm making a list, and we want to thank folks who joined us. We also have individual state data sheets that we'll be able to share with folks as well. But I'll pause there to see if there was any final questions. And Shilpa, want to make sure you were able to ask all the questions that you had as well.
Yes, we got through all of our questions here. I wanted to, if there are no other questions, I want to echo what Vanessa said. If you have any questions about the event or materials, feel free to reach out to me as well. Unfortunately, Representative Tai got pulled back to the floor, so she asked me to say thank you all for attending, especially Casey, family programs, and all the attendees. We look forward to continuing to engage with you. And again, thank you for attending. And Vanessa, if there's anything left.
No, I think that's it.
All right.
Great. Thanks, everyone. And thank
All
you,
right.
CSG West, for the partnership. We appreciate it. Thanks, everyone.